Jeff, welcome to the podcast. We've got Jeff Topo with us. Very excited.
Right there.
Yep.
That's
so,
man.
Functional medicine specialist. He's a PA that he's done some amazing stuff. He's worked with a lot of guys within our department and has been helping to work with hundreds of people. It sounds like your business is expanding and is getting even bigger and bigger. So, welcome to the podcast, Jeff.
No need for a plug, I guess, huh?
Yeah.
Thanks, guys. Thanks for having me.
So Jeff, we got you on here because you're very knowledgeable in a lot of different disease pathways and kind of the issues why we have all these chronic issues going on with a lot of different demographics and stuff. Like, so specifically we're talking about first responders and like kind of chronic inflammation that's going on, some autoimmune issues. You're just a whiz when it comes to the and everything. So what we'd like for you to do is kind of dive into what you do and what you look for when you get like the blood labs values and everything and like all the draws. So what are you looking for and how do you go forward with the things that you find?
Yep. Yeah. So I would say if we're talking specific to like a first responder, firefighter, paramedic, ER worker, whatever, who they've got a few things right off the bat that are kind of working against them, which is going to be like a disrupted sleep-wake cycle, right? So we know kind of no matter how long somebody works, like in a ER or as a firefighter, like we were programmed to sleep when it's dark and be awake when it's light, right? So you guys kind of fight against that. Right. So you start affecting things like the circadian rhythm, then you talk about sleep disorders that develop, you talk about things like hormone imbalance, low testosterone, low IGF-1, things like that. So when I look at a firefighter, I'm going to run labs. Yeah, I like to run a big panel on everybody, but I'm going to run some labs that might be a little more specific to that firefighter on a new patient panel. So, the things that you guys tend to be at risk for is, higher rates of things like prostate cancer and things like cardiovascular disease. And a lot of that comes down to the stuff you get exposed to, disrupted sleep-wake cycle, so hormone imbalance, right? All of this stuff plays a role. So we want to check all these markers, and we don't just want to check like the basic stuff, right? Because just a regular CRP for inflammation or something like that, it's just like, okay, well, the general person is going to have inflammation, right? But the question is like, these first responders, firefighters, they're going to have like a big environmental burden. So, I really talk to them about that right off the bat as well. And when I'm looking at my markers, I'm going to say, okay, there's higher risk for these things. So you really just want to make sure you address those and take a look at those early on. And one of the things, like, for example, that we'll look at is a basic kind of generic autoimmune marker. And then we'll also look at like a true cardiac risk panel. So we're looking at multiple different inflammatory markers. We're looking at not just kind of like total cholesterol, HDL, LDL cholesterol, which is your traditional cholesterol. We're going to look at like ApoB, lipoprotein little a. We're going to look at your LDL particle number. We're going to look at HSCRP for your arteries. We're going to look at oxidized LDL. We'll look at what your plaque burden is with LP-PLA2 activity, how stiff your arteries are with ADMA and SDMA. So we really get a good picture of the health of the vascular system, how overactive is your immune system, and what your like hormone balance is, and then some of the obvious cancer risk markers like PSA and stuff like that. But then also, we're going to look a little bit at your genetics, right? So we're going to look a little bit at like how you methylate. I mean, I know I've gotten just 2 million questions about methylation. I've run more methyl panels and like the last like
is that Joe Rogan?
Did Joe Rogan I don't know.
That's the key word right now.
It was I think 10X, the 10X guy. He came on and he had a huge
I didn't listen to the podcast, but I'm super familiar. I think
Tucker
it was
gene, right.
Yeah, exactly. The MTHFR.
Yeah.
Yep.
So the H and I have that. I have that gene.
Yeah, I do too.
I've dove into that quite a bit too, because you can do your 23andMe, right? And then you can get your raw data from them, because they're kind of like the same thing with your generic blood panel, right? They just give you like, bleh, like here's this, but they still have all that raw data. So I was able to get that and then go to a third company and have more. So it's like my NOS, my motherfucking gene. There's like about, I don't know, COMT also, that was on there too.
Part of the methyl cycle. Yep.
So that was one of the things where I'm like, I've listened to enough people kind of talk about that and how important your genetics are. And we were talking about this before, how genetics are like, the analogy was genetics are the gun, right? But your lifestyle and environmental toxins are you pulling the trigger, right? A gun isn't really deadly until you use it and point it somewhere. Is that right? Is that kind of
no? It's 100% right. And I know, one of the probably most interesting and I'd say hot topics and functional medicine, at least, is probably like epigenetics, which is, the why does this gene turn on, right? Like, we've got genes. I mean, we have people that have the ApoE4 gene, right? And so they're supposed to get early cardiovascular disease and get Alzheimer's. I have a lady with ApoE44 who has lived an incredibly healthy lifestyle, and she's 94, and she's like sharper than 80% of the patients in my practice. So like, again, that just shows you she has the genetics.
There you go. It's okay.
I'm a homozygous. I'm
yeah.
APOE4.
So when you do that,
it's scary. Yeah.
Yeah. When you remember, you have the potential to influence those genes in a positive way so things don't turn on, right? I mean, it's kind of like when you're looking at genetics and you look at like the BRCA gene or the breast cancer gene. If you look at it back in the 40s, the percentage of women that were getting breast cancer is like in the 20% or something. And if you look at it now, it's in the 90%, right? That's why you have women just getting these mastectomies in their 20s now because of the risk is so high, right? Where that's just the epigenetic risk. Your burden from your lifestyle is really what's driving that. The inflammatory process, knowing your methyl status, right? Knowing if you have that MTHFR gene, methylation plays a role in how we turn off our DNA or turn it on. So that's very important to know. So yeah, I think that podcast probably brought the discussion of how important methylation is to the forefront. I think I always use a little bit of caution with it. I always tell people, you don't want to be careful. You do not want to over methylate somebody. So I see a lot of people now that have started to say, well, I changed all my supplements to methylated. And it's like, whoa, like, don't go crazy with this, because just how not enough of the methylation can turn something off. Too much can likely do the same thing. So you just have to be careful.
Is because I had that like knee jerk response when I saw that or listened to that episode. And so like for supplements, Thorne, you ever use Thorne, or do you like Thorne?
Yeah, I think Thorne is a good company. Yeah.
Okay. And that's what I've kind of weeded out a lot of different companies, and I've found that they're pretty good. They've got third-party testing, and they seem like they're pretty pure in their ingredients. And they have like Methyl Guard, right? And
yeah, I'm familiar. Yeah.
I had. Yeah. And so that's something that I use on a daily basis now but like you said, I'm like, am I doing overkill now because I got this? But I trust Thorne, and it's nice to be able to talk to somebody that's kind of in the realm of it and be like, oh yeah, no, that's a good supplement. You're not overkilling it with like everything methylated now.
Yeah. So now, is that something, your genetic testing, once you got this problem, you started taking supplements for it. Now, is this something that you want to do genetic testing like every year, every 2 years to see if it's actually working, or if you're
so actually,
is it?
Yeah, so you don't necessarily have to rerun the genetics, right? So you wouldn't rerun like an MTHFR on somebody unless you didn't know their status or something like that, and they didn't remember. But you, for part of that methyl pathway and the MTHFR gene, you can actually measure how well you methylate with homocysteine, right? So homocysteine production. Typically, you're not going to check, or you shouldn't necessarily check an MTHFR without a homocysteine. Like you want to make sure. Like I have people who, let's just say they eat a pretty good diet and they are methylating well and they're healthy overall. They have low levels of inflammation. They don't have a super high environmental burden. I don't necessarily give that person the same dose of a methylated folic acid or a trimethylglycine or a SAMe as somebody who has a homocysteine of 35, right? If I see a homocysteine of 35 and a homozygous MTHFR, I'm probably going to give them a little bit higher dose and a little bit more support to try to get that down. That person, it might be a good idea to get a full methyl genetic test on them, right? Through like companies like Genova and some of these other companies who have great methyl tests. Then if you have like a person who has one of those MTHFR genes who has a normal homocysteine level, I still want to support them, but they probably don't need that same dosage.
Is because they've got the MTHR. What are they looking? What are you looking for? What are they dealing with symptom wise? So this is the thing that they talk about. Just because you have the gene, right? Is it acute or chronic things? Like maybe they're not seeing it now, but they've come to you and they've said, okay, well, I have this. I've got some small like fatigue or this or that. Like, what are the big symptoms that you're seeing from not properly methylating?
Yeah, I think because the methyl cycle plays a really big role in so many different things, right? It's part of one of the ways you detoxify, right? So like if somebody does it, if they have a SNP in their MTHFR gene and they don't detoxify well, the more you accumulate of certain toxins, the more likely you develop mitochondrial dysfunction and then secondarily fatigue, right? And then probably if that goes on long enough, brain fog. And then probably if that goes on long enough, weight gain. So it's like you would see a cascade and it would depend on the I would say a lot of different factors, to be honest, with how you would kind of present in a clinic as far as symptoms, but that would be something where a genetic predisposition, you would see people in the clinic for not just those types of symptoms, but methylation actually is one of the ways we get like our neurotransmitters across our blood-brain barrier, right? So like some patients, really good psychiatrists for a fair amount of time have been checking people's MTHFR gene. I mean, they might have been the first people in conventional medicine checking it, I think, to be honest, and really good ones. I know when I first started practicing like 15 years ago, really good ones were already giving their psychiatric patients, or, maybe not, true like psychiatric, like people who just had depression or anxiety, they were giving it to them. And some patients ended up not needing medicine. Like I have some of those patients in my practice. So, you can see this present in many different ways, right?
Okay, and that's great to hear, right?
Yeah, it is.
And sometimes you can get ahead of the ball, right? So you can basically see there, so it doesn't get to the point where now you've got brain fog, you've got weight that you can't lose, and then the cascade of diseases that come from that. So,
well, that's kind of the point of your functional medicine, right? Is this like we've been
proactive, not reactive?
Yeah, we've been so long. Western medicine's like, okay, you're sick now. Here's a pill, but that's why I'm coming to see you, because you run my blood work every 4 months and you're like, okay, this is starting to do this. You tweak my vitamins, you do this, you do that. Right. And that's, we got to get ahead of it, because, and if you do all these tests and we can, like Eric, right, he can get ahead of this now he knows how to eat and he knows what to stay away from, and he knows that he needs to exercise more, and he knows these things that are going to help him down the line. And that's the point of why we have you on here, right? Because there are a lot of things that we can do to prevent these things from happening to us in the future.
Oh yeah.
So, and knowing
100%.
you got to know about it.
Well, and if you're not testing, you're guessing type deal, right? Isn't that's like the oldest thing in the book is like,
100%.
I don't feel this way. So I'm just, this supplement, I heard this podcast and this supplement will probably fix me. It's like, until you know the actual values and what's going on in your body, it's just a crapshoot. You're just like,
maybe you'll figure it out, but probably not.
Yeah. You can get lucky, or you can be pissing hundreds of dollars down the drain.
Yeah. I mean, my urine is very yellow every morning.
Yeah.
Yeah. Oh, yeah. And I think, you could even get into the realm of, we don't probably want to talk about this much, but like I see patients that, I mean, generally speaking, you're probably not going to do a lot of harm if you're taking some just basic supplementation, vitamin D, a multivitamin, things like that, a fish oil. But I see patients that just go out and buy the cheapest stuff that's never been third-party tested. That's never, and it's like, you might as well not take anything unless you're going to take something that's been, looked at a little bit.
Yeah.
Invested. Yeah. Exactly.
Yeah.
Back to your blood test and how it has to do with more of the first responder realm. I mean, we kind of got sidetracked, which is good. That was a great conversation.
I think we're kind of getting into sleep and like, our sleep cycles,
what the job does to us,
and cortisol levels.
Yeah. Yeah. And I think, like we were talking about, I mean, I think when you look at this blood panel, I have things in mind that I'm going to address, like, very specifically with a firefighter that I may not have to do with somebody else, or I may tweak this blood test, which we have for somebody that's slightly, maybe they have a different job. Maybe they don't have the sleep wake cycle issue or some of the same risk, but they have other risks. So this type of medicine, this space that we're in with the functional stuff is really more of an individualized look at things. Because I think that's one of the problems with conventional medicine is if, it's our kind of blood work, our genetics, there's just nothing really cookie cutter about it. So that's a lot of the times why when you look at labs, just for example, let's just say we look at a firefighter's lab and we say, hey, look, testosterone, the normal range is anywhere from 300 to 1200, right?
Oh, crazy.
Yeah.
That's an insane range.
That's and it's massive. And typically what you're going to get, I had a guy today from Sac City that I saw as a new patient, and his testosterone was 320, and he has Kaiser, and his doctor said, hey dude, you're in the normal range. Like, it is what it is, and it's like, well, here's the thing. I'm not going to argue that it's not in the normal range, but so is 1100 or so is 900. And if you don't tell me if I improve his testosterone by 3 times, he's not going to feel better, you're crazy, right?
Absolutely.
That's like the craziest thing I've ever heard. So again, I think looking at this, not so black and white. I think looking at all the labs we run, not very black and white. It's not, oh, what is my LDL number? Like, here's our goal. It's, where do we see risk completely drop off with ApoB, or where do we see risk like significantly drop, just to give you an idea of, what our true risk is moving forward. So I think it's not, is this in the normal range? I think it's, how do you feel? What's your risk? What do we really want to see these numbers at based on research? And that's how you should really look at these labs.
Optimal.
How do you
we want
feel?
You to be optimal, right?
Yep,
it's
exactly.
a big thing.
We don't you're at 300, you're within normal range, but that's the bottom of the barrel. You can't be feeling good
right.
with that,
Yeah.
Like, sure. That's just such an easy thing to say, like, oh, and you're within the range. Okay, fine. Yeah. Goodbye.
Right.
But wait, I feel like shit. I don't have any drive.
I don't
have
any libido.
I don't
want to have sex.
I just want to sit on the couch all day.
Yeah.
Like, oh no, you're within range. You're fine. Go ahead.
Yep.
That drives me.
Yeah, I have seen some of the craziest numbers where people are told that just is what it is, and you're just gonna have to live with it. And it's like, man, I don't know about you guys, but I want to be like super functional. Like, and when I see somebody that's like 45 with like numbers in the 100s, and their doctor tells them like, hey, welcome to 45 or something, it's like, dude, I want to be pretty, vibrant and feeling like I can still work out and do it is in my 80s, right? So it's like I think it's crazy to think about.
There's a way to do it, right?
So
there's a healthy way to do it.
100%.
So what would be your recommendation? And we're still going from side to side here, but like the testosterone, like really kind of going towards that. What are some low hanging fruits of just improving? Because I know even some minerals, right? Zinc is such a big part of it. And, ZMA, they've talked about forever. Like just that is a pretty easy way to start. There's Tonga Ali. There's Tribulus, like, was forever. I remember when I was in high school, you could use Tribulus, which is an herb that's supposed to naturally lifting heavy weights, doing compound movements, or sunlight, or vitamin D. Like, are these some of the things that you kind of talk about with your patients? Like, hey, let's start here and see if we can't get a positive increase, and then if we need to get that extra little bump, maybe we try something else.
Yeah. Oh, 100%. And I always am going to offer somebody like, this is really how you can change your testosterone if you're motivated to do it on your own, right? I think, we get to a certain age where sometimes, that type of stuff just isn't going to work as well. But if you get somebody in their 30s coming in, you can absolutely make an impact on their testosterone by improving diet, reducing inflammation in the body, getting kind of their pituitary testicular axis to work better. Less inflammation just means you get better communication between the pituitary and your luteinizing hormone talking to the testicles, right? And then production of testosterone. The things like we talked about, like getting good sleep, absolutely great research on a lower carb diet and lifting heavy weights being something that really improves testosterone. I've seen some pretty significant changes in guys. I had a guy in his 30s that I think he came in and his testosterone was like maybe 380 and he really wanted to boost it up. So I just said, hey, look, lift weights 5 days a week, eat a higher protein diet, cut out inflammatory foods like gluten, dairy, and processed sugars, and give it 3 months and come back and let's see what we get, right? His testosterone was like 850. So it's like you can really do that if you're motivated. If people aren't as motivated because they just have such fatigue, profound fatigue, I'm usually going to talk to them about like underlying causes like environmental toxins, your heavy metals, that'll really affect your energy levels potentially for some people as well as their hormone levels. Things like the environmental toxin profile, volatile organic compounds, BPA, zearalenone. You've got all these crazy toxins that get into us through our food supply and just through our environment. I mean, firefighters have huge environmental burdens going to fires, dealing with the chemicals and fire engines and turnouts and all these things. Those things get in your system and you can detoxify to some degree. But when you start kind of getting into somebody getting enough in their system with environmental toxins, a poor diet, that just really snowballs. And that person's probably not going to feel good enough to be working out 5 days a week, put in an effort with their diet. So a lot of times what I'll offer is things like Pregnol or Clomid to boost their testosterone to getting to feel better for a while, right? And then hopefully they feel good enough to work through some of the diet environment testing I would want to do to rule out some of these underlying causes.
Okay. And then I know there's different, detox pathways, right? We've got like our liver.
That was a good one. He got me on that liver one.
Yeah, so
glutathione was awesome.
Like glutathione, right? That's the master, right? That's one of the biggest one. Our liver produces it, right? Mm-hmm. I mean, I've even heard. I don't know how you feel about like coffee enemas. They've said that that's like one of those natural ways, endogenous ways to basically produce your own glutathione. Is there?
Oh yes. Oh yeah. Oh yeah.
Are you a fan of infrared sauna at all? Like along with a binder there? Like yeah.
Yeah, so 100%. So there's some pretty great companies out there that make full detox kits. I always keep a lot of those in the office. I literally 100% of my patients that come to see me, I try to get them to do this at some point. Sometimes it's I feel it out a visit, and if they're like kind of open, then I'm pushing it visit one, because I could get, if somebody comes in with 10 complaints, I know I'm going to get rid of at least a few with a detox, right? So the way I like to do it is to explain to people like your detox kind of, not just kind of the pathways, but the areas you get rid of things from. I kind of think of it as like your liver's one. You've got kind of three phases there. You've got like a hydrolysis reaction, a glucuronidation, and then a sulfuration type reaction through the liver to kind of get things, molecules hooked on, so you could kick it into the digestive tract and pee or poop it out. You also you have your gallbladder, right? So I'm not a huge fan of like people having some sort of unknown abdominal pain and they just take out their gallbladder. I think that's crazy. You detoxify from there. Yeah, you emulsify fats, you detoxify. So it's crazy, right? And then I think the most important system is your lymphatic system. And so I'm a huge fan of that. So I basically talk to people about, look, with a detox, if you get a good company, you could do it individual, but if you get a good company, they will support all those detox pathways with powders and supplements. And you're going to do it for anywhere from 10 days to 1 month. And you have to eat a diet with it, right? If your body pH isn't high enough, it doesn't matter what you're taking with your supplements. You will recycle those through endohepatic recirculation. So if you eat a crappy diet and you're trying to detox, good luck, dude. You're just going to recycle that consistently, right? So yeah, there's a science to it. The really good companies have figured this all out. And you could certainly encourage that with activated charcoal, doing saunas, working out during it, sweating, right? All of that stuff. You could do cold plunges. You could use ozone. You could do IVs. You could really take it kind of as far as you want. But I always tell people, if you just stick to the diet and you do the detox, you'll see a significant, it doesn't kind of matter how optimized you think you are. I mean, I eat a pretty strict paleo diet. I work out 6 days a week. I do one of these every year, and I usually do I do a 2-week one, and I usually do a 6 or a 7-day one as well.
Just because that's the world we live in, and that's our food.
That's our environment. Yeah.
Environmental factors.
I mean, too. Like, you can eat as clean as possible, but we like to live a little bit, right? It's kind of like 80-20 rule. No matter what, something's gonna get in there.
You're going to get exposed. I mean, the statistic is when a female wakes up in the morning and is getting ready for her job or getting her kids ready for school, by the time she leaves to take their kids to school or go to her job, she's come in contact with 450 man-made chemicals in her home and in her environment. And like, if you think you could live with optimized mitochondria and detox pathways like that, you're crazy.
Yeah. It is scary, the world that we live in, and then put on top of it kind of like our field of work that we drive into, right? So I mean, like the sick people that we are in contact with, the houses that were, burning buildings, and then water damage from that, there's mold, there's like all these different things. Same thing with like any shift work. Like, think of a nurse, right? How much are they in contact with all the different chemicals that they use?
Sick people
that they're just trying to treat people. And then, I mean, just disinfectants half the time have like some gnarly stuff in it.
Oh yeah,
it's crazy.
Simple Greens, just
yeah. So it's insane to think that we can get away with just living our lives with a decent diet. It's sad. I mean, like, it is. If you want to live optimally these days, you have to supplement and you have to take these necessary procedures to feel better, which is sad.
Yeah,
it sucks, but
100%.
that's
Go be Amish. Go be Amish or something.
Yeah, I mean, if you want to go live in the Amazon, but then you have to deal with things that will bite and give you disease there.
Yeah, you could probably do some self-sustaining stuff if you had some property, with raising your own cattle or having your chickens and growing a garden. I mean, you could do it if you were, independently wealthy or had a job where you could
Exactly.
work remote 100% of the time. Maybe you could probably do it.
Yeah,
I know.
So yeah. So first responders, the biggest thing that, I feel like I suffer from when I was on the medic, and I know he's still on the medic sometimes, is it's so important, and it's something that we can't really get rid of, is sleep, right? Like, we have to run that call, right? And our REM is so important for we're producing so many hormones in our REM sleep, our GH and our testosterone. So how how do we compensate for that? Because I mean, you can go take a nap, but it doesn't matter. The nap's not doing what that 8 hours with, solid REM sleep is doing for you. So what would be the best way that we can optimize that?
Yeah, I mean, I think that's exactly right. Is you would. So if you have the ability to like take a nap, that's actually gonna help you regenerate some of your cells and tissues, and you're gonna clean things up a little bit. The job is not necessarily conducive to like a super, healthy baseline with that disrupted sleep wake cycle. So what I always like to tell people is when you're not at work, you really should try to focus and do your best to kind of get good sleep, get your good REM sleep. Hard part is when you're sleeping, there's so many active processes happening, that if you're consistently not getting good sleep, right? I mean, you're gonna be at risk for your risk is higher for everything, heart disease, cancer, like it's everything, right? I mean, it's just gonna go up and up
so
and up
yeah,
and up.
whole thing. Yeah.
And so you can control some of this, right? You can't control how many calls you do, but you can try to control it by not overdoing your caffeine, right? Just to kind of stay awake so that if you do get a chance to kind of take a nap, you could actually take a nap and benefit from that. I think, a lot of us will really get into this kind of dependency on things like caffeine to kind of get us through the day, which I'm not against a little bit of caffeine. I'm just saying, like when you're using it as a crutch, I think it's very different than enjoying like a cup of coffee in the morning or something like that. That also has antioxidants, right? I mean, so.
And then coffee, what its half life is like 8 hours or something like that. So it can stay in your system. Like again, talking about genetics, some people can process it quicker than
Yeah, they
others.
can clear it
But
faster. Yep.
right. So, I mean, rule of thumb, I know I always try to, if I'm going to have my last, beverage that has caffeine in it, I think I don't go past 2 or 3 o'clock, and that's still pushing it. That's like towards the end for me. If it's past that time, like I just don't even do it.
Do you notice that you
Yeah.
can't go to sleep?
Oh, for sure.
Yeah.
Yeah, absolutely.
I don't
Like
drink caffeine that much, so
I don't know the exact process, but your frontal lobe, like when I try to go to sleep, it's like it feels like I'm more active. Like the thoughts just it's like the monkey brain. I feel like that I really have to. One thing that I use for my sleep hygiene is reading. Now I feel like I can like kind of turn off the front of my brain a little bit and relax and kind of just like shut it off a little bit.
yeah.
So like that's been a big thing for me. But if I do have caffeine late, I see that it takes a lot longer. Like my sleep latency is way worse.
Mm-hmm.
Yeah.
So
yeah, no, and I will sometimes even suggest to people like considering if you're, not a super like open person to maybe trying different stuff like meditation and this and that. I will talk to people about things like there's some pretty cool devices out there nowadays. There's one that I use personally, and I've been for quite a while, called Brain Tap, and it's pretty neat. It's basically like this headset with an eye shield, and ultimately what happens is you've got for like virtually everything you could think of for why you'd want to use something meditative. It's got a walkthrough for you. So whether it's PTSD, whether it's I've got anxiety, whether it's I don't sleep well, whether it's I want to feel more motivated, this device will actually reset the right and left side of the brain to be in harmony again. Because most people, they're in this kind of beta brainwave state where they're at, where they're like, yeah, that's like when we're engaged, like right now, we're in that state, right? So we need to be kind of focused. We need to be engaged enough to talk to each other. But really, once you start to unwind or get into a state where you're relaxing, you should transition, right? So you should transition down into your theta state and your delta state. And people have trouble doing that. And it's actually, in my opinion, it's really hard just to be able to meditate and get into those states yourself. This kind of device, pretty cool. I mean, you can literally just close your eyes and it uses binaural beats and acoustic tones, and it pairs them with lights like into that. If your eyes are closed, it hits the optic nerve and it actually resets those brain waves. And it's pretty wild. I mean, I've been doing it for a while, and the first time I ever used something like this, like it was in a super busy venue hall with like 5,000 people. And I like looked around when I was done. I was like, oh my God, did it work already? You know, it's pretty cool.
So I've jumped into the binaural beats, right? And correct me if I'm wrong, how it works. You have to have two independent, speakers, right? And then so what it does is based off of theta or delta or alpha, they'll have like 320 hertz on one and then 328 on the other. And the difference, so it'll be 8 hertz, right? Wherever you're trying to get that brain wave to kind of switch over to. Is that correct?
Yeah, it's totally right. And even like you could go even further where, like the device I use, they will argue, oh, you actually have to have noise cancellation on for it to work super effectively. And I know some people will just have them on before bed. And I mean, there's probably something to it where it's going to work on some level, but it certainly isn't going to get you into that kind of connected both sides on the same level.
Yeah, you need that actual visual as well.
I don't. Yeah, no, I don't. You don't have to have the visual aspect. You really don't. You can just do the acoustic stuff. This just really gets it. You get there so much faster.
So yeah, more senses, right? And that optic nerve is extremely powerful, right?
Exactly. And I mean, we get inflammation around our optic nerve, right? That affects people's contrasting vision. And this kind of it can help with all of that stuff, reducing inflammation in the brain.
Same thing with like red light therapy, because I've heard that you can kind of do some red light therapy that's really good. Like I have a Juve Go. It's like a really small panel, and I'll do that sometimes in the morning. I know that's supposed to be really great for your optic nerve.
100%, buddy. Yep.
Yeah. Because I know blue light's not terrible. I think blue light gets
before bed
villainized, right? Yeah. It's extremely important in the morning, correct? Mm-hmm. I mean, like you want to see that hits your optic nerve, and that can actually, because cortisol wakes you up, correct? A spike of cortisol.
Yep. Cortisol is one of the primary, one of the primary circadian rhythms that go up with your testosterone and things like that in the morning.
So cortisol is extremely important, and we want it. We just don't want it chronically. Like there's certain times like the circadian rhythm that you're talking about. And it's the same thing with melatonin at night. Like you want that. I always say like, this is the new thing. Look at the horizon when the sun's going down, because the angle of the sun that what it hits is like that red light that can stimulate your pituitary gland. Right. And then your body starts producing more melatonin endogenously. Mm-hmm. And I heard that. Exactly. How do you feel about the supplement when it comes to melatonin? I've heard mixed reviews on melatonin, because it's like the dosage that they typically have is like supernatural. Like we don't produce that much, and it's like almost too much for the body.
Like a 5-10 milligram is too much.
Yeah. So I would like to get your thoughts on that.
Yeah, I think this one is you're going to get half the community saying it's incredible and we don't dose it high enough. And then you get the other half who say like, be careful, it's causing all sorts of problems and sleep disorders. I think where I would stand with melatonin is if I'm like talking about like myself or what I think is optimal is to get enough production on your own is what I would say is the right answer. I think it's a little different if you start looking at some of the cancer research that's going on right now, and really high dose melatonin. It's one of the most powerful antioxidants for your brain. And so it also is just an overall powerful antioxidant. So we are utilizing it at this point in really high doses in cancer therapies. And there's been some really good effects. So I don't want to say I would never use it or I don't recommend it, but I also would say in the average person, I would say not relying on it is what I would prefer to tell somebody. I think producing your own, if you have to use it to sleep, um, there's definitely things you can work through to improve your sleep without having to rely on it. I just think you have to be willing to do those things, right? I think you have to be willing to shut your phone off and not look at it, before you go to bed. You have to be willing to not have TV on. I think you shouldn't be drinking caffeine as late as people do. I think, doing something meditative to make sure those brain waves are getting into the right state. If people are willing to do that, I think they can sleep without melatonin most of the time.
It's funny. A lot of this stuff that you're telling us right now, the core of it is discipline, in my opinion, is the willingness and the ability to do the easy things. Because honestly, a lot of the stuff that you're talking about aren't that tough, and the entry into it is free or cheap.
Yeah.
Right. Many people just have such a hard time just doing the easy things. And, I'm one of them. I definitely struggle at those times of staying disciplined and doing, because I know to do these things sometimes and it gets away. But all of a sudden I'm on my phone for like an hour before I go to bed.
Yep.
I think, giving yourself grace, one thing, right? You mess up a night or you mess up a morning. Don't think like, I just got to throw it out. But to know that there are these things, if you choose to go down those paths, like the easy stuff, you can get the supplements, you can get the medication, but those come with consequences too. It's like, what are you willing to sacrifice? Seems like the overlaying theme here.
Well, yeah, because we've had so many things pushed on us that aren't good for us, but they make us feel good and they make us entertained, and it's instant gratification.
All the dopamine hits. It's just boom. It's designed
dopamine.
For you to be this way. And then I think as a society too, we don't like to do the individual thing like you're talking about, to really dive in and see what's going on with you. And like, well, this pill usually gets rid of most things for a larger population. Cool. Done. We're good. There you go. Take that and I'll see you tomorrow, or I'll see you in a month.
Yeah.
Right.
Yep.
I like compliance wise. Have you seen some people kicking back, or what seems like be the biggest hurdle for people making themselves better? What do you see in your practice?
Yeah, no, I think, I kind of tell a lot, like when people have something going on and they've seen 5 doctors and they have 3 specialists and nobody knows what's going on, I tell everybody the same thing. I just say, if you're willing to work with me and do what I say, whether it's testing or change your diet or look at your environment, or I guarantee I can get you feeling 10 times better than you feel now. But that's the hurdle. It's usually you get to a point where if somebody's willing to do everything, they're going to get better. Like they're going to get better. They're going to feel really good. But I'd say the majority of people are willing to do some stuff. They're not necessarily willing to do everything. And I think that's the hardest part for people is you can get folks feeling really, really, really good independent of their age if they're willing to actually do some of the testing or start with what I'm suggesting, right? Because maybe I think, I'm going to get rid of 50% of your complaints if you just do a detox first, as opposed to running some expensive testing that I probably know is going to be positive and then I'm still going to detox you the same way, right? So I think it's really, if somebody's motivated, I can kind of make you feel as good as you want.
And 50% of ailments gone, man, that is just such a better quality of life just off the bat, right? If
Yeah.
people can at least get
Yeah. I
there,
mean, it's,
and will go to you anyways, they're usually sick and tired anyways.
Yeah.
They've found you, they've like hunted around, or another functional medicine practitioner. It's like, I'm sick and tired of being sick and tired.
Running around in circles with the doctors telling them, "Oh, I don't know what's wrong. I don't know what's wrong."
Right.
Yeah, it's got to be really frustrating. I've never dealt with anything like that personally, but I know people that are dealing with it right now that I have recommended to you, and I'm like, "Hey, call this guy. He'll get you dialed out." And they're very, very frustrated people.
Well, I think honestly, I think when you look at it, I would say this: the folks that are like motivated and willing to like make a few changes. We've talked detox. I tell people like there's very little I can do to make you feel most of the time pretty different in 2 weeks if you're complaining about a bunch of things. There's just not a lot you can do in a really short period of time for some people to feel like it changed their life. Like I've had patients where it's like, this completely changed my life, and it's like all they did was a 2-week detox, right? I mean, it's like, it's crazy to think that that's for some people, that's too much effort. I mean, I actually had a lady today who's not like, she came to, this is our second visit, and she's not doing well, right? At all. Like she basically was forced into retirement. She's like maybe 58 or something. And she was supposed to do this detox. And I had a few other things. She kind of didn't get to those, but she did the detox. And she said she felt no different, right? And I said, wow, that's pretty incredible. Cause I could probably think of a couple of people out of doing like 1,000 of these with patients that didn't respond. And then the more we talked, the more she didn't follow the diet at all. She just took the supplements and did the shakes. Like, and I was like, well, that's like what I'm talking about, right? It's like, are you willing to actually put in a little bit of effort? Yeah, I mean, I think it's really always on the patient. I can make them feel better. They just have to be willing to do a little bit of work.
So I want to touch on that a little bit too, is that, the detox thing is huge, but it's only one part. So I would like to talk to you more about diet, right? So something that you've seen that has been effective, right? Obviously you say, hey, do this detox. And also I need you to be compliant with this diet. So diet is got to be one of the most controversial things ever in the health and wellness. There are so many tribes of vegan, carnivore, keto, you name it, paleo, and they are just so dogmatic about it. But there's also the people that have been in the clinics and have seen and kind of, and run all the test, right? Yeah. Of seeing what's inflammatory and then what can improve inflammatory responses. So I'm curious what your stance is when it comes to diet.
I'm like I think everybody that sees me in the clinic will know I'm like, I think they think I'm a little much with the diet stuff. But I would just say this. I don't think there's a single diet for everybody. I really don't. I mean, there are some really cool genetic tests that you could do that are suggestive of kind of how they'll use an algorithm to tell you maybe how you should be eating. I will say this. In the United States, there are some foods that absolutely nobody should be eating based on the inflammatory cascades they generate. And those are kind of your traditional dairies. I don't think everybody's lactose intolerant. I just think nobody should generally eat traditional dairy. I think there's something to like unprocessed dairy and things like that I'd be fine with as long as people tolerate it. And you could also measure, like when I run a panel on somebody, I measure their arachidonic acid and linolenic acid pathways. I measure their levels, right? I want to know like what your diet is going to tell me. Are you eating a lot of fried foods and seed oils and dairy? Because those numbers are probably going to be high, right? So when I talk about diets, I don't think there's one for everybody, but I do think that should be out of your diet. Processed sugars should be out of your diet. And then gluten in this country, you can't eat it. It's just, you cannot eat it. It's so highly modified that we know now at this point, every autoimmune marker is linked with, gluten. And then there's some direct ones that we've known about for a while now. So I think if you want to say, okay, I'm willing to kind of look at my diet and make modifications, I think you're going to do a lot better if you cut those things out in general and have them periodically. Sounds good if they don't bother you. I do think there are some people who, no matter what, kind of myself included, I just stay away from them, period. I just do. They really create an inflammatory process. And again, I'm not doing it to look a certain way. I'm just doing it because I feel really good. So I think that's just important. And I think most of us, like, we know our bodies. We know if you cut stuff out for a period of time and then reintroduce it, if you tolerate it well, you could go further, right? I do some fast testing where I look at food allergy sensitivity profiles, where it's not just an IgG, IgE. They do a IgG4 for a delayed food sensitivity reaction, and then a C3BD for an amplification reaction from your immune system. I look at a lot of gut profiles to look at how you break your foods down, how you digest them and absorb them, what 3 levels of your immune system are doing with their inflammation, how healthy your gut microbiome is, and what type of postbiotics or microbiome metabolites you produce, what the distribution is. Do you have parasites and other stuff? I think it's all part of the optimization process. If somebody really wants to know, you get some patients who say, dude, I want to be optimized. They do all this stuff, right? They do all these tests, and we work through every trigger and every overgrowth and every heavy metal and every environmental toxin and all the mold stuff. Like, we work through it all, and you could really make people feel really good. Not everybody needs that, right? But some people, to make them feel really good. I've seen chronic, like, there's a condition that I see a ton, and I get huge majority of my referrals are for it. It's called chronic inflammatory response syndrome. And for a really long time, people have said that there's just like this group of things that cause this illness. And it's things like Lyme's disease and mold. And it's just not a big list, right? I have a lady, like, I've had a lot of people, but we're talking about diet. So I just want to give you this example. I have a lady who tested positive for that on her blood markers, as well as a vision test is how we screen for that. So she failed both, right? Miserably. And we worked through some of the causes. Most of the testing was pretty negative. She did get really good benefit from one of those environmental detoxes, but she was nowhere near where she needed to be. And because we worked through all these tests, and I said, hey, look, I know this sounds maybe even crazy to you, but if you'll commit to this diet for me, and I'll guarantee on some level you're going to notice a difference. I was just convinced at this point that it was mostly related to her diet. And so I put her on what I consider is one of the better diets out there. Low inflammation diet, right? So she did it for 3 months. She came back. She lost 45 pounds. She passed her vision test. She has literally no complaints. And it was all diet.
So what is this magical anti-inflammation diet? Is it just paleo?
This was just kind of the right diet for her. And we actually talked it over. I just said, hey, look, these are kind of your options in my opinion for your diet. And I gave her kind of a list. I said, look, these are the things we want to cut out. I said, I'm not going to know right off the bat what you're going to feel best on. But we have to kind of figure this out. She wound up actually doing really well with a paleo diet. So for her, that's just the one that worked the best. And part of the reason was, and like getting into this, the way I convinced her to do this was I got to a point where I ran this food allergy sensitivity profile on her. And so most of the foods, she had dairy that was really high, with the whole list of like all her dairy, all the gluten and the Gilead proteins and the wheat were just through the roof on every level. And then she also reacted to some of the grains. And I definitely see that with some people. I think some people tolerate it really well, but a lot of the grains have very similar proteins to gluten. And I think if you don't do well with gluten, you might not do well with some of the grains. There's some good like literature on that. So in her case, that was what she needed, right? Like I said, I don't think everybody has to be that strict and be on like a straight paleo or, like
keto
whatever. I
or
think you could
carnivore,
kind of,
right?
or an AIP diet, which is even more restrictive. I think you have to kind of figure out. Yeah, exactly. I think that there's a bunch, right? And again, I don't think there's a right answer for everybody. I think you definitely have to figure out where you feel best. And I honestly, I think there are folks who can tolerate good unprocessed dairy well, without the inflammatory reactions. It's hard to, like, you're not going to be able to convince me that people, even if they feel okay, like they're fine with gluten. They're just too much against that with the way it is here in the States. And the processed sugars, you shouldn't be able to convince anybody. And like the seed oils, like that inflammatory stuff, like it just is definitely,
it's in everything.
Yeah, there's just too much research on that, right? You can't argue that.
Everything in a box, right? So I mean, like any high fructose corn syrup is just terrible. Any seed oil, so you've got soybean oil, you got sunflower oil, you got canola oil is terrible. Like
sunflower oils, and I mean almost everything you pick up.
It's insane.
Yeah,
so like you said,
I think,
anything in a package.
Yeah, I think what people really, from a dietary standpoint, have to just consider is like doing a little bit of educational stuff and then actually looking at like what they're buying. So I just had this conversation today with a lady who we were talking about diet, and she basically said, well, I changed over to I think it's olive oil mayonnaise, right? And so I said, have you looked at what's in that? And she said, well, it's olive oil.
Because it can be a blend.
There is olive oil blend.
And so I pulled it up for her. It was like Best Foods or whatever. And so there was canola oil and soybean oil. Yeah, olive oil was in there, but so are all the other things. And it's like that lack of transparency in our food supply. Like if you want to start talking about like the real problem, that's like from a dietary standpoint, that's a real problem. People think they're making the right choice. And if there was some transparency, then I think we would all be a lot healthier. But that lack of it in the American food supply, I mean, you cannot do that in Europe. That is illegal, right? You can't do that.
No red dyes and yellow dyes.
We're so ass backwards over here. I think it's the commercial agricultural industrial complex.
Yeah.
I mean, like that.
100%.
Talk about that forever.
That's it, because it's the cheapest way. They just mass produce everything, and then it can stay on a shelf for how many more months because they do all these additives and stuff. It's really unfortunate because within this country, we used to know our butcher, we used to know the farmer, we used to know, and it was all local. And you can still do
40 years ago.
Yeah,
like that long ago.
To Europe, and it's just like I feel it's still that way a little bit, right? You still have a
big time, yeah.
Portions are
and
tiny.
You've got these family farmers that are not that far away that like really give a shit about it's like their heritage, it's their lineage. They take pride in what they do there, and now it's like you can't, as a farmer, you get pushed out by all these big companies that have all these lawyers and stuff and can sue you, forward and backwards because you have a Monsanto seed on your.
You walk into like any drugstore, right? Like Walgreens, for instance. Like first thing you walk in, there's candy, there's chips, there's popcorn, there's energy drinks, there's Coca-Cola,
low to the ground,
and then what's in the back? All the diabetic medicine, antidepressants. Like, I mean, they got a good system going.
It's a nice circle.
It's a great circle.
Keeps you coming back.
Yeah, you walk in, you get that crap, and makes you go to the back of the store eventually, right?
You'll be back. Yeah,
you'll be back. It's crooked, and I don't like it. We can get into that too, but I don't have enough time for that.
Again, it's a reoccurring theme. Less is more.
Diet,
right? Is just like simple is better is really what it comes down to. Like all these foods are they're hyper palatable, right? And so you get that addiction. And then I remember I did paleo very strictly right out of college.
It's tough.
And I had like a candy bar, and it was like overwhelming to the point where I like almost spit it out.
Yeah.
Because eating so clean. And if you have an apple or strawberry, you're like, oh, this is delicious. This has like a lot of flavor and this is sweet.
Mm-hmm.
But then it's 10 times that with a candy bar. And then you just like, after you do the candy bar for so long, it's like, fucking, this is strawberry fine. Taste. That doesn't have anything to it.
Yeah.
Yep.
So like
100%.
giving yourself a chance to kind of reset.
It's funny. Our theme for our podcast so far is basically everything's kind of fallen back onto like, sleep routine and diet and exercise. And what's that cure? Probably 90% of our ailments, right?
Yeah, man, I'm not sure I'd have a job if people just ate a good diet and exercise. I don't think so. Yeah. Dude, I'm telling you, man.
In hospitals. Yeah. The hospitals would be empty.
Yeah,
seriously.
Yeah, nobody'd be taking drugs, right? Nobody'd be taking pharmaceuticals. They'd be out of half of them be out of business, They'd have to do like our cancer rates would go down. So you'd have all these smart people doing cancer research. We'd probably have it cured, who knows?
Probably.
Pretty much.
Yeah. I think it's cured already.
Yeah. So yeah, that was fantastic information. Thank you a lot, Topo. That was great. And I mean, getting the diet, sleep, and nutrition down is great. And that can do so much and can move the dial. But there are things that we need to do to get that extra 10, 15% to really feel optimal, right? We all know what we're supposed to do. And if we do it, we're going in the right direction. But if we really want to, fix ourselves and be truly healthy and optimized, that's where people like you come involved.
What I would really like to, sorry, go ahead.
I was just going to say, I won't take too long in this, but I think, one important thing that I every day I kind of hear the same thing. So I'm 48. So I hear it a lot. I'll hear, I am in my 40s. I guess I should have aches and pains and I should be tired and I should be slowing down and this and that. The reality is like they've done research. So if people feel that way, they have some mitochondrial dysfunction, and that could be a whole podcast. I talk about mitochondrial function all day, every day. So, but the point is,
going to ask you about
brings me back to school.
That's exactly what I was going to ask you about.
Well, I'll tell you this. I will say this: like age is definitely just a number. They've done muscle biopsies on young kids and done muscle biopsies on older people in their 70s. And when you look at a mitochondria underneath kind of a microscope, if you're optimized as a 70-year-old, it'll look the same as like a 10-year-old. So I think really, you could feel as good as you want at virtually any age if you're willing to kind of do some of these things to kind of work through that optimization process.
And I think the mitochondria is fascinating, right? There's a bunch of, I'm sure you've heard of NAD, right? NAD is a big thing right now.
He's got me on NAD.
NAD, you can do the IV, there's oral NAD, but then there's even information on like HIIT training. So there's exercise that can increase the density of your mitochondria. I even heard Dr. Gundry was on Ben Greenfield's, and he said that nicotine is supposed to potentially help uncouple mitochondria, which I was going to ask you, like, what's your, especially with first responders and what's your stance on nicotine? Cause that's pretty rampant within.
Zins are running everywhere right now.
Yeah.
So
like that?
The interesting thing about that is I actually don't know what else is in it. Is it just, I would be surprised if there's not something to kind of cut the area so it gets in. So I'm not sure like delivery wise, but yeah, look, we definitely know it's a nootropic, right? It is. We also know it's pretty addicting and can kind of change some of the brain chemistry. So I'm not sure I would suggest that it's the best idea. But I will say there is good evidence that it is a legitimate nootropic. And for sure, I've read some stuff on how it can improve mitochondrial function. And, I don't know that I would suggest that that's how you do it. I would say you could do it a lot of different ways, right? Removing some of the the environmental stuff we talked about, so the mitochondria don't feel so nervous about that inflammatory particle, right? That'll turn it back on. Or tapping into, things like some supplements that improve your mitochondrial function, like creatine, CoQ10, L-carnitine, resetting your immune system with some of the peptides we have out now, thymosin alpha, thymosin beta, tapping into some of the mitochondrial enhancing peptides, right? You get somebody with COVID and they have long COVID. A lot of the times I can just supplement them with D-ribose and creatine and L-carnitine and CoQ10 and then get them on a mitochondrial enhancer like injectable NAD or SS31 or MOTC or 5-amino-1-MQ. All of those guys are going to improve mitochondrial function. And a lot of times you do that for a short period of time and their mitochondria turn back on, right? And so everything changes. All of a sudden they can detox all of a sudden, right? You want to open up your detox pathways, improve your mitochondrial function. A huge percentage of the time when I detox somebody, if they're willing, I'm sticking them on NAD or one of these things that'll enhance their mitochondrial function to get those detox pathways working faster.
Yeah. And those are the little powerhouses in the body. We all learn that. It's like biology 101, right? And so if those are, aren't working correctly and they're misfiring, they're doing all the wrong things, then that's like, that's just having dirty fuel in the system at that point, right?
Well, yeah, virtually every complaint somebody has, some of that comes from mitochondrial dysfunction. It doesn't matter if it's your memory. It doesn't matter if your muscles aren't as, strong as they used to be. Some of that is going to be mitochondrial dysfunction. So that's really, when you start talking about statistics and mitochondria, 90% of your energy you produce comes from the mitochondria.
Trillions of them too, right? It's just the abundancy in the body, right? And if they're all, not functioning properly, then you've got a big issue there.
And it's as early as 30, we lose half of them that aren't functioning anymore. And
correct.
And that's just a snowball effect, right? I mean, if half of them were optimizing again, then they're just it's just that synergetic. It's just gonna help. And I mean,
totally.
Since you have me on the NAD, I feel energy levels are through the roof. I feel like my brain fog has been going away. I mean, I did do the liver detox as well.
Nice.
December, but which was tough. But I mean, it wasn't that hard. It's only 2 weeks, right?
Yeah, it's 2 weeks, right? I think
yeah.
If you buckle down and just kind of say, hey, look, it's only 2 weeks. I know I'm going to get some sort of benefit from this. And again, the more kind of optimized your mitochondria are, I mean, you really are reducing your risk for every single disease process known to man, like literally.
Yeah,
it's insane.
Let's move to another new and hot topic is peptides.
Yeah.
So peptides are extremely interesting, right? They've been around forever. Everyone thinks that they're these crazy things, but it's like 5 to 50 amino acids chained together make a peptide, right? It's nothing crazy. Like a protein has more amino acids than a peptide. Most of these things are naturally forming. We synthesize them, but like there's the big ones that are out there. So what is it? Impamorelin, tesamorelin,
CJC 1295,
BP57. You've probably heard that there's really a lot of controversy around that because they're trying to make it illegal in the United States.
Because it works.
Because it's so cheap, the gut makes it naturally, right?
Mm-hmm.
Yeah.
That is where it basically starts, and it can repair the gut, which you're a big gut guy, right? And then a lot of inflammation comes from the gut. And then if you do it locally, it can have they call it like the Wolverine peptide. So you've got issues in your knee, your joints, whatever, you can do it locally, and it's supposed to have some pretty profound effects. Same thing with TB500, like those two together. TB4. I've heard nothing but insane things.
Yeah.
Like miracle drugs almost. And they're so simple.
Yeah. Yeah. There really is. There's really almost kind of a peptide at this point for everything, right? For every kind of want or need or, weight loss or sports performance or increasing lean body mass. And BPC was discovered a really long time ago. I think in the 50s, maybe. And that's, I believe 15 amino acids long. So yeah, I think epidolon might be 3, which is kind of what we call a bioregulator. So there's certain peptides that we call bioregulators. So that epidolon like resets the pineal gland in the brain. You've got these bioregulators for the heart, you've got a prostate one, you've got an ovarian one, so you've got a thyroid one, so you can kind of
gland or
reset
organ.
things, right? And I don't know that there's a right answer for this, but those bioregulators, one theory is that how fast those cells turn over is kind of how you decide how often you do it. So maybe some of these organs that you're resetting, you need to do it once a year, and maybe sometimes it's every 6 months. But I think probably for sure the BPC has been the most popular one on the market for a long time. It's really incredible. I use it orally for gut repair and reduction of inflammation. I also use it, like you suggested, as an injectable, and frequently pair that with something like thymosin beta 4, which is the natural version of TB500. And that kind of together is kind of called that Wolverine stack. I've had a lot of success with it. I've used it for patients with frozen shoulder that I thought maybe I'd have to do a stem cell injection on. I've used it. I typically use it if I'm working with stem cells at all. I typically at least recommend it to the patient that they're likely to just get a better response. I mean, the stem cells work great no matter what, but you'll probably get an amplified response if you use it. But yeah, I've seen some crazy things get repaired where.
Did Aaron Rodgers do that for his Achilles?
Oh, I would suspect.
Dude,
I've seen.
That's the first thing.
He's probably getting stem cell injections every day.
Oh, he would have definitely. He definitely did stem cells for sure. I mean, he's buddies with Joe Rogan, so yeah, he did stem cells for sure. Yeah,
fetuses every other day, right?
Yeah,
yeah. I'm sure. I'm sure those guys. Yeah, no, for sure. But I'm sure he combined it. He probably went somewhere like, to Neil Reardon's clinic in Panama and had that, and I'll guarantee they did BPC and thymosin beta 4 with it, right? Yeah, I mean, for sure. But they're the peptides, I think what I tell people is one of the things that I've found, at least, is, some of them are fun to just like offer to people to just truly optimize them. You get athletes and people who want to be bigger, faster, stronger. You just get people.
Which one for that?
Ipamorelin?
Well, I mean, I think you could combine a few, right? So you could look at some of those ones like CJC and AOD and IGF-1, tesamorelin. All of those guys are pretty darn effective. And again, I think I would say the caveat with some of the peptides is there are some you really should like know what you're talking about. I mean, you don't want to go giving somebody who has a history of cancer like a growth hormone boosting peptide, right? Not at least right away. And I see some people doing kind of craziness or just buying it off the internet, which I'm okay with. And as long as you make sure, you didn't have melanoma, and now all of a sudden you're using melanotan to get a tan. I mean, that'd be insane, right?
Well, that's why it's good to come see you and get your blood work, right?
Well, and I think
inflammatory factors and.
Yeah, you want to measure all this stuff, right? I think there's things like BPC that you could take without, you don't necessarily have to measure something if you have an injury to use BPC, right? But I think some of these GH boosters, you want to know your IGF-1. You want to know you should only take certain ones for a month at a time. You definitely should like talk to somebody who at least has some knowledge of when and where to take these and if it's a good idea. So, yeah.
The ipamorelin and tesamorelin they're basically essentially the same thing, correct?
Similar.
Well, they're similar. Tesamorelin, I would say, has.
I think.
It is. It is.
Segregagrog,
yeah.
Yeah, they are slightly different. I would say the research would suggest that tesamorelin, when taken at the probably one of the dosages where it's working best, that will increase lean body mass like really significantly, and do some targeted weight loss in areas where, we haven't really had things that, you talk about like semaglutide or tirzepatide for weight loss, and you're not going to get a targeted weight loss. You talk about tesamorelin or AOD, like you're going to lose weight in your midsection, and a female is going to lose weight in her hips and in her thighs. Like it's going to happen. So you do have some targeted weight loss stuff now.
Yeah.
It works really well.
It's just as good. Turn your stomach
into
stone.
Right.
Yeah. My God.
Yeah.
Well, this stuff it's pretty impressive, right? The potential of a lot of these things. And
yeah. Oh, no, totally. I will tell you this. I mean, this just tells you kind of how, our country is and how ingrained we are with, the pharmaceutical companies. But some of these peptides are used in Europe. I mean, thymosin alpha has been used for a long time. I use it all the time in patients I'm treating for mold or anything where their immune system is really dysfunctional. I'll use thymosin alpha, thymosin beta as a reset. I use it in autoimmunity and with cancer patients, and I've had great success. And Italy has been using it for a really long time for like HIV and other stuff. It's like, it's a prescription medication. Here you're talking about a drug company where they're not going to be able to probably patent something like that and make a bunch of money off of it. Kind of like the whole stem cell thing, right? So it's just not available. It's just like, BPC. I mean, like, well, we've got that naturally in our gut. We can't really kind of patent that. I don't think we want it available, right? I mean, that's what you're looking at.
It's like the same thing with the ivermectin thing, right? That's such a simple drug that's been used for so long. Like they won an award for that way back in the day in like the 40s or something, that ivermectin came in, and it's 100% anti-parasitic.
Well, they take it on Sundays in Africa because of water that they drink.
And like river blindness. Yeah, that's what it was. Yeah. It like got rid of river blindness like that, right? And like it's such a short period of time. It's like, why wouldn't it's a protease inhibitor just like Paxlovid, right? Why wouldn't we just use the cheap stuff?
Well, you can't make money off it.
You can't.
Yeah, exactly.
Well, and I heard people taking ivermectin when the whole COVID thing was going through, and then seeing all these other side effects. Are like, I had all these issues and I took ivermectin and things got better.
Yeah.
Other things that I've been dealing with forever, right? Because it's so potent in so many different fields. Like that's why it's such a great drug.
Yeah.
100%. Yeah. 100%.
Can you are you able to get your hands on that stuff anymore? Or is it they pretty much shut that down?
No, actually, you can, it's actually pretty available. You could actually get it online pharmacies, and I've used it for quite a long time. I've always gone through the compounding pharmacies, which the ones I know, I compound so much stuff that these companies, they know me, these local facilities know me really well. They just, I used it all through COVID with no problem at all. The only negative was like it's like anything, they started charging, like $300 for a 5-day COVID prescription when it used to be a couple of pennies.
10 bucks.
Well, they got to take advantage.
Yeah, but at least they prescribed it, because the CVS and Rite Aid, they were like, they'd send it back and say, we're not filling this, right? So at least we had the ability to fill it though.
Was that, so if you prescribe, I got COVID tomorrow and I was sick and you prescribed to me, is that something, am I going to have to pay the $300 out of pocket because it's a compound?
No, you would, buddy. Yeah, you would.
Yeah.
But I could send you packs of it and it'd be covered.
Yeah.
It's wild.
Yeah.
Well, this has been fantastic. We've learned a lot from you, and we appreciate your time. Like, this has been a wealth of knowledge, and my mind's been blown. Like, all this stuff we're talking about is just stuff that I try to listen to and try to figure out more about, and actually talking to somebody who's so well versed in it has just been such a privilege. So
yeah,
thank you a lot, Jeff. This
you got it, guys. Awesome. I appreciate it anytime.
Yeah.
I think we would like to do this again with you and really like hammer out the peptides and like talk about optimizing, growth hormones and just whatever, insulin.
Another peptide.
What that does, another peptide, and like how important that is for our body. And
insulin's extremely important in the body.
Yeah, it's like how it works, and and why it makes you fat or skinny or whatever it is, right? I think
100%.
that would be really fun. Maybe we'll take like the top 10 or something. We'll just talk about each one for 10 minutes or something like that. And
I'd love to actually, I mean, I've been hearing about you forever, and then finally getting to talk to you has been amazing. But like even showing, I'd even like to maybe even go in and get my blood work done with you, and we can actually show people like what you actually, because you
can show mine,
right? So like we could show our blood work, like how comprehensive of what you do and what you're looking for. Like I'd love to have that where you take my blood and then we like kind of talk it over a little bit.
I would love to see you two nerd out about that.
And then we could even like, go from there and, see like based off the lifestyle changes or whatever, how much it's changed for the better. Like, I think that's powerful to see that, to like show people, we're here and now we're there because of these things that we talked about.
Yeah. Yeah. 100%. Absolutely. I'd be happy to do that.
I mean, we just have my first, I think I've had three tests with you now. We could just pull my first one and my third one up, and I think you have me on niacin. You have me on niacin for cardiac. You have me on fish oil. You have me on vitamin B's, vitamin D, vitamin K. Mm-hmm. That's it. And like, I mean, it's just with those, just been dramatic.
Oh yeah, the numbers look way different. Yeah,
numbers look way different.
See,
my LDLs went way down, and which you said they weren't very that bad. Standards are fine, but not for your standards,
Yeah, one thing I'll say that I've found, I think it's pretty funny, and I've just seen it since, over the last few years, is that unfortunately they're changing lab values to fit the standards of how unhealthy we are, instead of just leaving the lab values for these folks that, the white blood cell count, now the low end of the normal range is 3.8. And we do know white blood cell count is a measure of inflammation, right? So like, why not elevate that? And then maybe even move the upper echelon, just because we said we have so many unhealthy people. It's just like, that's like insane to me. Like, we're so unhealthy that they've changed the LDL from 130 down to 100. It's like, I don't know, man. We need our cholesterol to make our testosterone. I mean, it's the first hormone in the pathway made, right? I don't think if you have low inflammation and you do things right, you can have pretty high cholesterol and live a really long period of time without a heart attack. There's a ton of people. There's a ton of people that
correlation and causation, right? So I think that's where we got wrong with it. As they said, oh, well, they have high cholesterol, so this is causing heart attacks. So it's just like, it's the inflammation to the vessel, and what's cleaning it up and what's like repairing it is cholesterol. It's the first line of defense, right? Yep. So they're, it's there at the site of injury. Well, it's because because you're eating too much sugar and you had poor lifestyle and you had these stiff arteries that are breaking. Like,
I think doing its job to fix it.
Is 100%.
The arteries, how strong they are, how flexible they are, right? Yeah. If they're just rigid, and that's what causes us to have heart attacks, right?
Yeah.
Yeah, and I think the reality is we can do some pretty basic testing to show somebody's risk. It's really not that expensive, even if somebody's just like a cash paying patient. I use a company where I created this pretty darn big panel for like some of my patients that have Kaiser. It's not $20, but you can get a really large panel for right around $380. That gives you really good risk markers to talk to you about, like some of this stuff we're talking about with, the arteries, how stiff they are, how much plaquing you have. And you really, to be honest, like just through changing things like diet, lifestyle, you can also tap into some of these supplements, right? We talk a lot about like statins, which reduce inflammation and regress plaques. You could actually do it with some really natural supplements we have out. They've some really good studies on that. So yeah, don't always have to go to medication.
Yeah.
We need more of that knowledge out there. Like just
right. We do. We do.
Like that's the thing. This needs to be a public announcement that, there are these options out here that we don't have to go pharmaceutical every single time. Like, can we have a conversation about some very cheap and affordable and easy access supplements and lifestyle changes? Like, holy crap.
Dead in a ditch though. Watch out.
Yeah. All right, Jeff, this has been fantastic. We're definitely getting you back on. I'm definitely going to talk to you. Like, I'd love to talk to you more and
no more room.
Yeah.
New patient. Sorry.
I think we can make an exception.
Yeah, I'll try to weasel my way in there somehow.
Yeah, we'll make an exception.
Yeah. Oh, cool. All right. Well, Topo, it's been fantastic. Thanks you for being on the podcast. This is
awesome, guys. Thanks so much for having me.
Yeah. Awesome.
Cool.
All right. Well,
Jeff.
All right, guys.
Just hang on for a second because we got to make sure that it uploads and everything.
Yeah, we lost like